We're going to hear from Samantha Hunt from A Better Balance, who is going to talk to us about workers' rights around breastfeeding.
So my name is Samantha Hunt, and I work at an organization called A Better Balance. A Better Balance is based in New York City, though we have offices in other parts of the country. We're a legal nonprofit organization that helps workers and their families understand what legal rights they have and to get support at work. We also do help pregnant and parenting students get access to accommodations at school so that they can learn free from discrimination. And that includes helping them with their pumping needs. So the two main things our organization does are first, we run a free and confidential legal helpline. And second, we work to pass stronger laws to help protect pregnant people and new parents at work and at school. So today I'm going to give an overview of the PWFA and PUMP, which are key laws that provide rights to pregnant and postpartum participants at work. I'm also going to go over some scenarios that might come up in your work with people who are pregnant or who are postpartum so that you can better recognize when these laws might apply. I'm going to leave a little bit of time at the end for questions. I'd be happy to discuss general questions with you, but if you have more specific questions, I'm happy to exchange contact information and we can set up a time to discuss those directly. So how we can help. So I help staff a legal helpline where people can call with questions about their rights at work and at school. Our helpline is completely free and it doesn't cost anything to call and get information, and it's completely confidential. The number is here on the slide. And I have the ability to send out physical cards with our contact information in the services that we provide on it. And so if anybody would like those, I have them in English and in Spanish and can send them. So let's get into the content here. So here's an example of someone who is pregnant in the workplace. So Shannon works at a large manufacturing center. She's currently 4 months pregnant. She has difficulty lifting heavy items due to her pregnancy. So is she entitled to any changes in her job duties? The answer is yes. Under a new nationwide law called the Pregnant Workers Fairness Act, or the PWFA, Shannon likely does have the right to certain reasonable accommodations for her pregnancy. Under the PWFA, employers generally must provide reasonable accommodations for health needs related to pregnancy, childbirth, lactation needs, and other related conditions, unless providing these accommodations would constitute an undue hardship. This is a very big change in the law because up until last summer, workers in many parts of the country only had the right to pregnancy accommodations if they also had a disability. So under this law, workers generally don't have to be able to perform every single essential function of their jobs, so long as they will be able to perform those duties after their pregnancies. This is another big and exciting change. So in the past, workers had to show that they could perform their main job duties. This meant that a lot of workers, for example, I see a lot of WIC participants who are home healthcare aides. If they couldn't lift more than 15 pounds, but they had to work with bedbound patients, that would mean that they're not able to perform an essential function of their job. But now, a lot of workers who just need to be excused for a few weeks from that essential function are protected under the law. So a reasonable accommodation means an adjustment to a worker's schedule, job duties, or work environment that allows them to perform their job. Some examples of reasonable accommodations that pregnant and postpartum workers could request include things like additional breaks to drink water or to use the restroom, the ability to keep snacks and water at their workstation, time off to attend prenatal or postnatal appointments, or to recover from childbirth or pregnancy complications, a temporary transfer to a less demanding position, and assistance with certain work duties. Now, these are just some examples of accommodations, but essentially an accommodation can really be anything that pregnant and postpartum workers need from their employer to help them do their job. So the PWFA makes it illegal to retaliate against a worker who requests or uses a reasonable accommodation for their pregnancy. Retaliation can look like a lot of different types of punishment. It includes things like firing a worker the day after they submit an accommodations request, cutting back somebody's hours or refusing to schedule them, which is something that we see a lot, or placing a worker on unpaid leave when a different reasonable accommodation is available. It could also include things like assigning somebody attendance points for taking time off to attend things like prenatal appointments or other types of protected absences. So if you're talking with somebody and they feel like they're being punished because they have pregnancy-related needs at work, you should have them call our helpline for assistance or connect with me directly. Now let's transition to talking about lactation needs. And let's check back in with Shannon, who is our worker at the manufacturing center. So Shannon gave birth 12 weeks ago, and she's been out on New York paid family leave, which ends next week. She plans to return to her job in person full-time, where she works 8-hour shifts. She's currently nursing, and she'll need to pump while she's at work. Luckily, Shannon is protected under a new federal law called the Pump Act. The Pump for Nursing Mothers Act, or the Pump Act, is a federal law that provides most workers with the right to private space and protected breaks to express milk. Under the law, most workers have the right to reasonable break time to express milk at work. So how much break time is really considered reasonable under the law? Generally, reasonable break time is as much time as the worker needs on the worker's schedule. Some states have their own lactation laws that establish certain baseline timeframes that provide guidance for how much time might be appropriate, but those are really just baselines. Workers who need more time could still be entitled to that under pump. So under the Pump Act, these breaks to pump don't necessarily need to be paid. But if an employee is pumping and they're also performing their job duties, that may count as hours worked and those breaks should be paid. So if you're working with someone who has questions about how much time they can take to pump, or if they're having trouble getting the time they need, please have them call us. The Pump Act also allows most workers to have the right to a private non-bathroom space to express milk. So the space doesn't necessarily have to be a permanent lactation room, but it does need to be shielded from view and free from intrusion from coworkers and the public. It also has to be consistently available. So every time the worker needs to pump, this space needs to be available to them. The Department of Labor has issued certain guidance saying that the space must also have certain features, including a place for a worker to sit, a surface to place a pump, and a way to store milk, such as an insulated food container, a personal cooler, or a refrigerator. And I will also note that anecdotally, New York law actually requires certain other features like nearby access to refrigeration, an electrical outlet, and nearby access to running water. So again, if you're working with people who work and live in New York, especially in the Bronx or in New York, in other parts of New York City, have them give us a call because there might be additional protections on top of the ones that I'm mentioning that help protect them. So like with reasonable break time, employers with fewer than 50 employees may not have to provide this pumping space if it would constitute an undue hardship, but that means that it's significantly difficult or expensive. Some other states have their own laws that are more protective than the Pump Act, New York being one of them. So it's always a good idea to suggest that people call our helpline to get information. The Pump Act generally provides protection to workers for up to 1 year of their baby's birth, but other laws can give workers the right to lactation accommodations longer than that if needed. So if somebody has questions, again, have them call our helpline. As I mentioned, participants may have additional rights under state and local law, and if they live and work in New York, they very likely do. For example, New York has paid family leave laws that give a lot of workers the right to time off to recover from childbirth and bond with their new baby. The nationwide law, the FMLA, only gives workers the right to unpaid leave, so it's important that New York has a paid family leave policy. Many states like New York also have paid sick time laws, which workers can use to receive paid time off to attend prenatal or postnatal appointments or to receive medical care for certain pregnancy and postpartum related conditions. So for more information about what laws might protect participants at work or at school in New York, I'd encourage you to have them call our free legal helpline. We also have a workers' rights hub specifically for new parents in New York on our website. So I just wanted to talk briefly about what else we can help with. So people can call our helpline to get information about their rights at work and at school. We provide information about workplace rights related to pregnancy accommodations, paid sick time, paid family leave, paid medical leave, pumping at work, pregnancy and caregiver discrimination, and other related issues that come up. We all can also provide information about what rights they have as pregnant and parenting students at school. For example, rights related to pregnancy accommodations, excused absences for childbirth and recovery from childbirth, certain accommodations for lactation needs, and sex-based discrimination because they are pregnant or because they're a parent. So again, information about our helpline is on the slide. My email address is also here. If you have additional questions, feel free to contact me directly. And I'd really encourage you to have folks connect with us so that we can talk more in depth about what rights and options that they might have under these various laws. So thank you.